The World Trade Center program is probably saved my life. 14 of our friends, Eddie's, and our friends died that day. We're 20 years later. With Dr. Moline, Dr. Wilson, and the entire team, they've got me hooked up with tests, with surgeons, and it's a lifesaver.
Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle, and today we're reflecting on the 20-year anniversary of 9/11, and our special guests today are Eddie Reyes. He's the program manager at Northwell Health's Emergency Management Center. We have Scott Strauss. He's the vice president of Northwell Health Corporate Security. And we have Dr. Jacqueline Moline. She's the senior vice president of Occupational Medicine, Epidemiology and Prevention at Northwell Health. She's also the director of Northwell's Queens World Trade Center Health Program. Welcome, everybody. Thanks for joining us on this special podcast. Scott and Eddie, you guys were down on the pile. What's it like now for you 20 years later? And just tell us what your role was when you were down there.
I was a police officer at New York City Police Department assigned to the Emergency Service Unit, Truck 1 in Lower Manhattan. I got down there just after the second tower collapsed, and I can't believe it's been 20 years. Feels like yesterday.
Yeah. And Eddie, what was your role?
I was also a police officer assigned to Emergency Service Truck 8 for NYPD. And we got there again. I got there a little after Scott, obviously. He's in the area that covers the World Trade Center. So, we always job like this. Everybody from all five boroughs came to help. So we just came right over the Brooklyn Bridge as gingerly as we could with the mass of exodus out of Lower Manhattan. And we started working right away. And we didn't stop figuratively for 9 months.
Dr. Moline, they said that the air was safe down at Ground Zero, and some of these, first responders and civilians and iron workers, they spent months down there breathing in that toxic air. Just tell us a little bit about what's happening at the World Trade Center program in Queens and what you're seeing and what you're doing.
Well, the air wasn't safe to breathe, and that was a political statement that was a colossal mistake. In terms of what we're doing at the Queens World Trade Center, we are part of the programs covered by the Zadroga Act, meaning that we are able to provide comprehensive medical services for World Trade Center conditions for anyone who is affected as a responder. There are other programs for folks who are in the fire department, and then also there's a program for folks who lived or worked in the area or reoccupied buildings in Lower Manhattan that get benefits as well. So our goal is to make sure that care is seamless and make sure we diagnose any World Trade Center health problems and get people into the best care they can get.
Yeah, and when you're monitoring these people who are down there, how important is it for them to keep coming and to, for them to stay on top of their care?
Well, it's really essential. And, over the years, I've worked to try to get some people who didn't necessarily come in right away to get into the program. And because even if they were feeling okay after 10 or 12 years, maybe at year 14, they didn't start feeling so well, but to know they'd already been monitored in the program, we could see that there was a change in their health. But more importantly, the reason it's critical for people to come back, even if they are in the group that doesn't have a lot of symptoms, is because we're always finding out new things. And we're on the cutting edge of being able to understand what the health effects are related to the World Trade Center so that we can get people into earlier treatment. In fact, a paper just came out that showed that folks in the World Trade Center program and all the World Trade Center programs who have developed cancers have a lower mortality than folks who aren't in the program. So it shows the program works. It shows we know the program helps people get the care they need without worrying about out-of-pocket expenses. But this also shows the program has saved lives, improved longevity, and it's something that we're really proud
of. Scott, what's this World Trade Center health program meant to you?
The World Trade Center program is probably saved my life. with Dr. Moline and Dr. Wilson and the entire team. They've got me hooked up with tests, with surgeons, and they're like, I was on the phone with Dr. Wilson's team yesterday for over an hour. It's very important, and it's a lifesaver, literally a lifesaver.
Yeah, I consider you an American hero. And looking at you, I wouldn't think there's anything, wrong with you, but you are suffering from some effects of being on that pile.
Yeah, thanks. My high blood pressure gives me a nice color. So, but yeah, listen, I'm on the right side of the grass. Thanks in part to Dr. Moline's team, and I'm okay with what I have. Some of my friends, 14 of our friends, Eddie's and our friends, died that day. We're 20 years later. I got to see my kids grow up. I'm going to hopefully see them get married in a couple of years. A lot of my friends didn't have that opportunity. So I have nothing, although I do have some issues, and I'm on a lot of medications and things, and I do have breathing issues. But at the end of the day, I've been here, and hopefully will continue to be here.
Eddie, what has the program meant for you?
Well, I want to echo Scott's sentiments, and Dr. Moline, thank you again, and your staff for what you've done to me. And I've had a couple admissions into the ED for my upper respiratory concerns, and again, I know, Dr. Moline, that the program has helped me. And again, I echo Scott's sentiments that although Scott and I, again, just two of many, many guys who are still alive going through the 9/11 effects, I think that we're very, very fortunate that we have the time to talk about this and talk to you, Rob, and Dr. Molina and the rest of the people listening, where other people don't have that luxury. And, you got to put it in perspective. You really do. And I could have, a real bad day. Scott can have a real bad day, but at the end of the day, it really doesn't matter because we're here talking to you. And yeah, we saw my two kids, just like Scott, grow up too. So we had a luxury, and we're very fortunate. And I think the 9/11 medical group was an integral part of that. And I want to say that publicly. And Dr. Molina, again, thank you.
You're welcome.
And Dr. Moline, you're not just seeing first responders. There were a lot of civilians that spent months on that pile. Tell us what they're eligible for too, and why it's important for civilians to be involved in the program.
So, when we started the programs, and I was part of the group that started the programs way back when in 2001, 2002, we knew it wasn't just confined to the traditional first responders, but, every construction site in New York stopped on September 11th, and thousands of construction workers went down to lend their skill to do what they could. So we've got a lot of construction workers, and then there were volunteers. And then there were folks like cameramen and reporters who were down there who were suffering the after effects. So the program is open to anyone who worked. The responder program, which is the one that Scott and Eddie are a part of, handles folks who worked or volunteered at the site, and it doesn't matter whether you were uniformed or civilian, and you get the same care and you get the same benefits. And I think it's critical, and it also for people who volunteered. It's open for volunteers as well. People should make sure that they know about the programs. Hopefully, after 20 years, most people have heard about it. But surprisingly, there are a number of folks. I was speaking to someone yesterday who was like, "Oh yeah, I was down there, and my husband also, and we're not a part of any program yet." And I'm like, "Come on now, join." And Scott will know I'm pretty persuasive in getting people into the program. But it's there for them. And thankfully we do see folks that were there and don't have symptoms, but we want to make sure they stay healthy, and we can provide some of that preventive care as well.
Yeah, and it seems like that's one of the issues with this is that people develop things much later. So people who feel fine today may find something wrong down the road. And I guess it's important for them, even if they don't have symptoms, to be enrolled in this program?
No, that's a good point because, we started the program and we didn't expect everyone to be symptomatic. And about 50% of people had no symptoms, but they stayed with the program. And then some of them, thankfully, have stayed healthy, but some people have developed, sometimes it's minor issues and sometimes it's more major health problems, but we get them into the care earlier. And the other thing that the World Trade Center programs, what we focus on are emerging diseases that we might see or conditions that maybe you see 10 years earlier in the group of World Trade Center folks than you would in a general population, but we're going to be keyed into making sure that we look for that. So it's really important for folks if they're eligible to come in.
Yeah. I would assume, Scott and Eddie, that, you probably promote this. You work for Northwell and, you have a lot of friends still. And I would assume some of your friends can try to be tough and say, hey, I feel fine. What do you tell them?
Get checked out. Whether it's Northwell's program or another program, get checked out. It's well worth it. And Dr. Moline is right. She is very persuasive. Thank you, Doc, in getting people into the program. Because I was one of those guys. I'm okay. And then, through my friendship with Dr. Moline, she's like, she very persuasively got me over there. And I encourage anybody, as Dr. Moline said, just not first responders. If you lived, worked, volunteered down there, and there were plenty of volunteers, the construction workers, the iron workers, everybody should, at the very least, go down and get checked out, even if you don't have symptoms. It's just, you got to protect yourself.
Yeah, and I think after that day, I think that everybody wanted to help and do the thing. And you had mentioned that there was restaurant workers, windows of the world, right? A lot of people were lost. They came down. They wanted to be part of the effort. They helped.
Yeah, there were restaurant workers from all across New York and Jersey who were bringing in food, and to the rescuers, to us. And they were there handing out sandwiches, and you're eating right there in the middle of everything, so the dust was getting onto the food, and we were breathing it in, as well as those volunteers were breathing it in. And it's just not for rescuers. It's everybody that was down there.
And that's correct.
Eddie, what are some of the things that, being in the program where you think that helped you or is helping you now?
Well, there were some guys, again, who didn't feel the need or the importance of this program. And like Scott, we also offered the opportunity to go. And there were a couple guys that I know personally that eventually did go and get checked out. And to this day, there's still people who I'm still kind of trying to encourage to go because the program, as we mentioned earlier, will help you. And at the very least, if it's not for you directly, then do it for your family. I think they owe them to their families to get checked out to make sure that they're okay. But there's a lot of guys out there, and I mean that with terms of endearment, ladies and gentlemen. There's both. They're very hard-headed, and I'm okay, and then they find out later that they have some type of illness that the doctor groups or the scientists are finding out there's a correlation between the exposure and the symptoms they're exhibiting now. So I highly recommend going through this program.
Dr. Moline, can you talk about some of the lessons learned in the program and what you've seen and what you've learned and how you're able to better treat people?
I think the greatest lesson we've learned is humility. And I say that not just because we're dealing with folks who are so selfless and the sacrifices that people made 4 months after 9/11, but I also say that in terms of it's taught us all to have a far more open mind for what can happen over time. And that what paradigms of medical, yes, this happens, but this only happens within the first 2 years have been thrown out the window. So I think it's allowed us over time to say anything is possible, and let's find the connection and see if there is a connection and see if the rates are. Unfortunately, sometimes it takes studies a while to find these answers. but it's worth sometimes going on hunches. I, in about 2007, saw a couple of, they actually were all law enforcement, but that was just, I think, absolutely coincidental. We ended up seeing a number of young guys who had multiple myeloma and put out a thought paper, which was a case series saying, people who are younger were getting multiple myeloma, which is a blood cancer that usually occurs in folks who are in their 70s. And these were people in their late 30s, early 40s. And it said, hey, we better be on the lookout for this. And then the studies have borne that out over time. So, it's focused our attention on being alert for little signals in the information, or saying something doesn't feel right. This shouldn't be happening in this age group. And then as part of a network, because we do have other clinical partners that have been a part of this from the onset, we all say, hey, are you seeing this? Are you seeing that? And what do we need to be on the lookout for going forward? So I think, we've learned that we need to be, in some ways, very impatient, meaning if you see something that just is a little off, make sure you follow it up, but also very patient in the sense that we need to continue to follow to look for signals so that we can detect new diseases that might be occurring. I mean, now it looks like there might be an increased risk of, a study came out of fatty liver, which is when there's abnormal deposition of fat within the liver. The rates appear to be higher from the World Trade Center exposures. That really hasn't been described before. We know that things like sarcoidosis, which is a disease that can affect the lungs and other parts of the body, is now associated with dust diseases. So those are things that we've learned, but we're on the lookout for. Are we going to see more heart disease? And are we going to see it at an earlier rate? I mean, heart disease is up there with cancers as being more common as people age. But are we going to see like a 10-year frame shift? Are we going to see people getting all these diseases much sooner than they would have, and be on the lookout for that?
We usually don't talk about when every 9/11, I get together with the guys that I was working with that day down in Lower Manhattan. We don't go down to the trade center. We go to the building where we worked, and we do catch up on people we haven't seen in a while and find out. We talk like we're 80-year-old people, like, oh, did you know so-and-so's not doing well? And, but sadly, we're in our late 40s and 50s, and these are conversations, like I said, 80, 90-year-olds usually have, and so we don't say to each other, oh, I found this wrong with me, I found that wrong with him, but, and they caught this early. It's just, we all know the situation we're all in, and we all understand what the consequences will most likely be. We're just supporting each other.
Jackie, tell us a little bit about how long Northwell's had this program and why it was so important for you to get involved in it.
So I had been running the World Trade Center program at Mount Sinai prior to coming over to Northwell in 2010. And that was during the time period where Zadroga was getting passed. And it just seemed like we needed to get back involved. And quite frankly, I'd been doing that work for 9 years. And I realized that it was, I missed being part of the program. So was able to stand up the Queen's program. Initially, we worked with the existing Queen's College program, but then it became a fully Northwell program. As the program changed, and you really needed to be part of a health system. But we had a great partnership with Queen's College at the beginning, and then continue that, and that's how it started. And actually, one of the requirements for those in Zadroga was you had to be, in order to lead a program, you had to have led a program or be a leader, because they wanted people with experience. And so I was one of the few people who fit that role that could have led the program. And it's really something that I'm happy we were able to bring to Northwell, just because we've been able to impact the lives of so many people. Many of our employees are in the program, but folks that find it convenient to come to Queens, we're able to provide a really great program for them.
I think, Scott, you just mentioned, 20 years seems like yesterday. I would assume for you guys, the images and are still so fresh. What's it like each time we come up to an anniversary, especially like a big one like the 20-year anniversary?
It's painful. The wound never heals. They say that time heals all wounds. That's a lie. It doesn't make it any easier. It's painful, and certainly the bigger anniversaries, the hallmarks, the 10, the 15, 20, the 25s that people make a big deal out of, aren't any more significant than year 19 or 18 or 22. The sad part is that more and more people will pass away from the effects of 9/11, and it's just a reality that we have to deal with.
Eddie, what's it like for you 20 years later?
It's like a year later, and again, we're just kind of saying kind of the same thing, Scott. Is that no matter how many years pass, and when we did the side by side, I was like, all right, how am I going to be? How am I going to be at the 15-year? How am I going to be at the 10-year? How was I going to be the day that it was open to the first responders when they first opened the site? And you question yourself, and you go, all right, I got a handle on this, and I have to really make sure everybody understands that you don't forget. And it's very hard. It really is. And as much as, and people, and when we go to a World Trade Center, I want to add this, again, give kudos to the group of the WTC group, that they always want to make sure that not only are you medically okay, but mentally also. So they have that component built into that too. And I've Dr. Moline, I've always, we always say, no, I'm okay. We always do the medical. We do they do the PFD. They put me through the mill. I get out of there. I'm very tired. And then at the end they go, oh, do you want to talk? And the answer is always for me is no. And because I really don't have anything to say that's going to be fruitful. Because I'm sure they've heard about it. They heard a lot of stories. I think Scott kind of hit it already. I think it's something we're always gonna be melancholy about, whether we're 50, 58, 59, or 70 years old, 80. We're always going to think about it. And no matter it's 20, 30, 40 years later, I think we're still going to have those memories. And we're probably going to have the memories of the guys we lost.
Yeah, the things we did, the things we saw will haunt us forever.
Yeah. But I think what you said before is so true. You have this a special appreciation for life because you say, I'm here still and I still get to see my families. And I guess that's even more important for you to push for your friends, to be checked out because
absolutely
each year is a gift, right?
Yeah. Every day is a gift.
And Eddie, next time you go, I do want you to go and maybe we'll make sure that it's at the beginning of your visit that you can find somebody and just check out because you'll find that you like our person. She's actually a former cop, so she's really easy to talk to. But that does raise a point. One of the hallmarks of the program was that we did integrate mental health component into the physical health program, and in fact. It's part of the program. It's not like, oh, if you want, for folks like Eddie who've been going year after year after year, there's still questionnaires everyone fills out, and if there are trigger points, and you're not given an option of whether you see somebody, you are evaluated. But what we did very early on, especially in the first, as it was just being set up, is we integrated social workers in the program. And it was a station just like the breathing tests where you just went there and there was no stigma associated with it. And I think as we look back and how things might have changed a little bit, just we've had the 2020 Olympics just now that even though it's 2021, and there's been a far greater focus on the integration of physical and mental health in our elite athletes. Well, these were our elite responders, and these were our, elite everything, regardless of whether you were a traditional first responder or whatever. And we need to make sure that the mental health concerns are dealt with in the same way that we're worrying about cancer. And the programs have been set up so that we do that. And I think it's really something that we're proud that has been a part of the program, but it's also critical for people to realize that, approaching these anniversaries can be tough, and to seek out care if you are finding it a little more challenging.
Yeah, and I would assume it's very helpful just to be able to talk about it, have somebody listen, or also be with somebody who
was there,
right? Yeah. Feeling the
went
same,
through it, yeah.
Right?
It was there, just like you guys have the opportunity, Doc. At the end, it's there, and I think it's still it's funny you say the Olympics. Me and my wife were talking about it too, about the mental health of all these professionals. And Doc, thank you for saying that we're also professionals. And we took our job very seriously, and I never thought of us as professionals. I just thought of myself as a public servant who went to school, got trained, and was able to do things that the city of New York allowed us to do. Didn't think I was any more special than anybody else. So thank you for saying that. That was very, very nice.
Yeah, Eddie? What's this medallion that you have right here?
Yeah. Show Dr. Moline.
Yeah. Here, Dr. Moline, if you could see this.
Oh, cool.
It's my son gave that to me not so long ago, actually this week, and it's a limited number. If you look at that's a 3-dimensional coin. You have the two sides and then the side of it, and it's not only 911 were made.
I said, like I was saying, it was so hard to comprehend for me. My wife was pregnant with our first child, and I was thinking, like, what a time to be bringing a kid into this world. Like, is this going to be normal? Like, whatever. But
when we were on the pile, which it was called the Trade Center for weeks and weeks and weeks, and then it morphed into the pile, and then it morphed into Ground Zero. But when we were at the Trade Center, certainly on 9/11 and digging through the rubble and trying to find people, we were hearing fighter jets fly over us.
Oh, right.
And we had no idea what they were, who they were. We didn't know if it was another country attacking us still. We didn't know if they were ours. Many folks had the opportunity to be watching this on TV, and we were digging and we were searching and climbing around. You're hearing these fighter jets screaming overhead, and you're like, "Oh, what the hell's going on here?"
And you could hear,
and then the gunfire.
Yeah, they were saying incoming, and you hear that from all over the pile. So you try. Where are you going to go?
Right.
Where are we going? We just kind of stayed.
And then you guys had to evacuate at 5:00 when 7 fell.
Yeah.
Yes.
When what happened?
When Building 7 came down a little after 5 o'clock,
Yeah.
they pulled us off the pile, the rescue effort, and then we went back in, and later on that evening, and started searching again, just to regroup to see if we lost anybody else.
And there was another scare. The building literally right across, I forget the name of the building, where we were using it for rehab, and basically just lay down on the floor in the lobby. And the engineers had some type of spotting mechanism to see if the buildings were moving and stuff like that. And they rang the bell 3 times, the horn. And they started yelling the building's going to fall. It started to shift. Again, all I know is that we were climbing over each other to get out from that building. So that was, and there was a couple of those. The Amex building across the way, everybody's looking at all the components outside because of that tub, and everybody thought the tub was compromised, but is that going to cause the exterior buildings to also be compromised? So every building was being looked at. So every time anything little, there was a hairline move, they used to blow horns and stuff like that. We used to run out of there. So it was pretty intense. Pretty intense.
Yeah, I think, after that day, and for us who were watching on TV, we were like, how do we go on? How does this world go on after this? It was such a dark day, but out of that dark day, there was so much hope. There's the way everybody came together on that pile and worked, and it didn't matter what your political beliefs were. Everybody was out there for the common good, and it was Americans at their finest.
There's a saying that Nobody wants another 9/11, but everybody will take a 9/12. Because of the patriotism,
Yes.
because of the support. And, Rob, you called Eddie and I heroes. In my opinion, we're not heroes. We were doing our job. We were doing what we had to do and what we needed to do. In my opinion, there are two groups of heroes, though. One are the families that had to continue on with their life when
Yes.
they've lost a loved one down at the Trade Center or at the Pentagon or in Pennsylvania. And the other group is the massive amount of civilians who pitched in, whether they volunteered at those sites or
Absolutely.
the school kids who are now in their mid-20s,
Oh, my God,
mid
yes.
to 30s, who wrote letters, cards, and the people who ran clothing and equipment drives around the community, around the country, and sent it to either the Pentagon or to us in New York. Those are the heroes because they didn't have to do it. What we did, Eddie and I, and our teams, and the firefighters, and the EMS workers, and the Port Authority police officers, and the court officers, and the federal agents that were there, everybody, that was kind of our job, is to get into that mix. We run towards that stuff. They didn't have to, but they did. The rest of the community and the rest of the country. And to have the support of the country around behind us, made a tremendous amount of difference.
Those are the heroes, right?
Yeah, and how we operated and got through that day and those months and those weeks afterwards. They are the true heroes.
The guys that made the sauce, that made the pizza.
Yeah.
Well, I think you
I think some of us differ a little bit on that. I think you guys are selling yourself a little short because, most people have a tour, and meaning that you have a shift. And I bet that your shift went a little long for for a few months, and that wasn't technically what you needed to do. It's what you felt you needed to do. So in our eyes, that, your job was to rescue and go in there, but you also went above and beyond. So in my mind, both of you and all your colleagues are heroes as well.
Yeah, and I think just you continuing your heroism by getting the word out and getting people the care and letting them know that there's care and there's support for them and their families. Jack, everybody remembers where they were. I guess we'll never forget where we were that day. Where were you on September 11th, 2001?
I had just finished a 5-day, 400-mile bike ride for a charity, and I was picking up my bike on Delancey Street. So, which is, about a mile and a half from the Trade Center. So we could actually hear the planes and we could see the planes coming in. And so I went back home, got my bike, went back home, and then was actually called into the hospital. And at that point, the only way I could get to the hospital was to get back on that bike to ride the 5 miles to my office. But and then we went back to the office and really, it was a feeling of helplessness. I actually stopped before I got called in. I live not far from the old St. Vincent's and now our new emergency department in Greenwich Village, and offered to provide care, emergency care if they needed folks at St. Vincent's, and then saw the line of people around the corner offering to give blood. So it was really, we did what we could, but that's where I was.
You rode your bike and you call us heroes?
In Manhattan, no less, riding a bike.
After a 500-mile tour.
Are you kidding me? That's great. That's great, Doc.
How has COVID affected first responders?
Some guys were extremely, extremely nervous because they felt they were already behind the 8 ball, and to get COVID would have been now the death sentence for them. And I got some guys. I did vaccinate some guys, and some guys I got appointments to get vaccinated. But they were definitely, and this is what I got on the phone calls. They were definitely afraid to get the COVID virus because they felt that that would be the end. That would be immediately the end.
Yeah, that's the truth, Eddie. I know that flashed through my mind. I had a close scare of getting COVID. It turned out to be a 24-hour bug, but I was with somebody who had a confirmed case of COVID for a full day, and then 2 days later he calls. I started to feel sick, and I didn't put two and two together. And then the following day after that, I was told by him that he tested positive for COVID, and I was like, oof. This is not going to be good for me. Mm-hmm. I already got some medical breathing issues, and like you said, it could have been a death sentence. And I was, thankfully, it wasn't that. It was a 24-hour bug that I had, but the timing was incredible and very concerning to say, all right, I whatever happened 20 years ago happened 20 years ago, and now all of a sudden I'm going to get taken up by this virus.
I know.
Yeah, it was concerning.
Dr. Moline, did you see a more significant impact on first responders?
I mean, some folks have died from COVID in the programs. A handful of folks passed away within the Queen's program, and program-wide. I don't know the exact numbers, but we certainly have had some deaths. I think one thing is that folks were so tuned into the fact that they had an increased risk that they were pretty good at protecting themselves. And, we were trying to advocate to get them bumped up on the vaccine list when they could get it, but really trying to make sure that folks, practiced the proper hygiene and wearing masks and doing everything they could or staying home as much as they could. Unfortunately, it's hard to isolate like we had to, but just we felt it was so important for people to understand. And in fact, our whole program went to telehealth for much longer than most of the other programs in the health system, because we just didn't want to increase the chances of anyone having to travel or potentially put themselves at risk by coming in. So we did all our visits for a while by telehealth, telemedicine. So, it is frightening. And I hope that for anyone who was in the World Trade Center programs, that they get vaccinated and they wear masks, and even now that they wear a mask, because we know that the folks who are at greatest risk of the breakthrough are people with underlying health conditions. So, we really urge our World Trade Center folks to stay masked.
Well, I really appreciate everybody being here. We always like to end on a positive note here at 20 Minute Health Talk. So I could just go around the room and I'll start with you, Eddie. What gives you hope? What gives you optimism going forward 20 years later?
Well, obviously the WTC program does give us, me and everyone else who's involved, hope medically and mentally. I think also we've come a long way, a lot of lessons learned. And I think if we keep doing what we're doing, I think we'll be okay. I think we're going to be okay. And we just have to keep supporting each other and making the services available to the people who need it.
Yeah, I agree. The program for me has given me years, and hopefully will continue to give me personally, being selfish, years, but also everybody that's involved in it years more than they may have had, and also the 20th anniversary and the fact that people are making a big deal of the 20th anniversary is important to all of us, whether it's the first responders or the civilians that were there that day. It's just not about the first responders. That it's never forgotten, and people remember, and it's important to remember and not to let something like this happen again.
Dr. Moline?
I think what gives me hope is that we were able to fight and advocate and get this program established. And we know that it's going to outlive all of us because it's for 75 years. And that we can still try to make everyone's lives a little bit better. And that's our goal every day, to give people hope, to give people great care, and to give them time to walk their kids down the aisle, or see that first grandchild, or see the first graduation, or whatever frankly is their goal in life. But hopefully we'll be able to provide the care and so that they can achieve their goals.
Dr. Moline, thank you so much. Scott Strauss, thank you so much. Eddie Reyes, thank you so much for joining us here on 20 Minute Health Talk. And for you, thank you for tuning in and listening. I'm Rob Hoyle. Have a great day.